Good morning, everybody. I'm Janice Duivestein, and I'm an occupational therapist. I work with Access Community Therapists, and I'm one of the dysphagia consultants that sees many of the clients around the North Shore.
Hi, my name is Jill Romanchuk, and I am a registered dietitian, and I specialize in swallowing. And I work with ConneXions as well as Community Living BC.
Today we're going to be going through some information around the topic of dysphagia or difficulty swallowing. And we're going to be talking through and getting you guys to actually participate in some of the activities that we've got planned for you today.
So why should we care? There are many health risks that are involved with dysphagia. So we're going to have a little bit of discussion around this and point out some of these things, and maybe you would like to think about that and share it amongst yourself when we finish this section. So health risks. Dehydration, the lack of fluids in your body. That can be a real concern with people who are having swallowing difficulties because their intake of fluids might be scary or limited. So then we have other side effects. A side effect of dehydration is constipation, and often we will see people complaining of constipation before we actually diagnose the difficulty in swallowing, because that symptom becomes very obvious as not enough fluid is taken in. The other thing is reflux or gastroesophageal reflux disease, GERD, you'll often see written. So reflux is indigestion, heartburn. The other thing is respiratory problems, where you may have chest infections, you may have pneumonia, in line with aspiration. So aspiration is liquids going down the wrong way. And most often coughing and choking will be very obvious symptoms. There could be other changes in health, and that could mean that different medications are being used, and medications can affect our swallowing, so that is something that we'd also be looking at. In turn, it may affect the person's level of functioning also. So we may see a decline in their well-being. We might see them frightened or agitated just before mealtime. So it can change the whole level. The importance of eating. Can anybody think of a celebration that we have that doesn't involve food? Very rarely. You go to the movies, we have popcorn. You have a family gathering, it's going to be focused around a meal. And there's many cultural aspects of dining, the socialization, the celebration, and so it's not just the need for calories to take in for your nutrition. There's a lot of pleasure around eating, and sometimes that's taken away when somebody's struggling and feeling afraid to swallow.
So Jill's outlined a couple of the issues that come up for us around this area, and hopefully you guys are thinking a little bit about some of the people that you work with and some of the things you might have noticed with them. Maybe they're losing a lot of weight, maybe they're coughing and choking. So those are important things, and the reason why we like to do these education sessions is because we all work together as a team, and you guys are a very important part of the team here. You're the ones that are with the folks 24/7. You know them the best. You're the ones that are going to notice all the changes, all the kind of issues that come up for these people. And so we need you to understand what kind of things you should be noticing, and then what you should be doing about that. So one of the most important things is, if you understand if you're seeing a lot of coughing or choking or weight loss or not drinking well, to make sure you notify your supervisor, who then will ask for a referral, and then we can actually get involved and help out. When we come to do a visit, we ask a lot of questions, and again, you're going to be the voice often for the person that we're seeing, because you're able to give us a bit of the history. So we will ask you about coughing and choking, we'll ask you about all these types of things, and that helps us form a picture. You also know what things work well and don't work well for that individual. So we'll work together to figure out a good plan to help improve the situation for them. So I just really want to emphasize why the importance of your role as being in this whole area of dysphagia, and why we need you to be well educated and to understand that. We will provide you with information, with handouts, with guidelines that will help guide you in knowing what you're supposed to be doing with that particular individual.
And let's not forget the individual. The client is the center of our visiting and the center of your support, and then we as consultants are around to support both you, the caregivers, but most importantly the individual.
We know it's not very exciting listening to us for a full hour, so we're actually going to have you guys follow along and Jill's going to be my lovely assistant here and do the demos for us. But you should have in front of you a number of different food items as an example, and we want you to follow along with Jill and do the same activities that we are, because this is to help you understand about food properties and what it takes to actually chew up and break down food in order to be able to swallow it safely. So the first thing I'm going to get you to do is pick up your stone wheat thin cracker, and if it's not already broken into 4, crack it in half, and then one of the halves in half again. You'll see Jill has got a quarter-size piece there. Now I want you to put it in your mouth, just on your tongue, but don't do anything with it. So Jill, could you please swallow that cracker for me right now? Okay, so hopefully you've all got the same answer as Jill, in that it's not safe for you to swallow that cracker. So I'm going to ask you to do 3 things, so think carefully and remember these. Jill, I want you to chew the cracker up and count how many chews it takes you before you're comfortable swallowing it. I want you to think about what things in your mouth you're using. What are the structures in your mouth you're using to break that cracker down? And thirdly, I want you to feel what the texture of that food it feels like just before you swallow. Okay? Off you go. Now, one thing you'll notice, as I'm going to point out on Jill, is that she's chewing it, she's moving it around her mouth from side to side. You guys might all be experiencing the same thing. And this is known as rotary chewing. This is what all of us with typical development will chew like. And it's important because not all of the folks that you support will have rotary chewing skills. Okay, I think Jill has swallowed her cracker. So how many chews did that take you, Jill?
28.
28, wow, that's a lot. So you guys can talk amongst yourselves as to how many chews it took you. 28 is quite a few. And what did you use to move and break down that cracker?
I started with my teeth and then used my tongue to move it either side to my teeth. I then had to work quite hard to bring saliva into my mouth because stone wheat thins are just flour and water. They're very dry. So I still feel residue in my mouth and still want to keep swallowing. So by the time I had finished chewing, it was like a gooey mess sitting on my tongue, and then use my tongue to propel it back.
Okay. And I noticed you mentioned you feel like it is, and I'm watching you, and you're moving your tongue around. So your tongue is a very important item, and most of you are probably right now trying to clear all the little bits of stone wheat thin out of your teeth. But your tongue is very important in being able to do that. So I want you to think about the tongue movements of some of the folks you support. Do they all have that ability to move their tongue in that way, or do they mainly just push their tongue forward and backward out of their mouths? If that's all you could do you think you'd be able to clean your mouth out and move food appropriately? Probably not. So Jill, you mentioned having teeth to be able to chew that. Which teeth were you using?
I was using my molars on both sides, moving it from side to side, and thankfully I have all my molars right now.
That's right. So I want you guys to think about, do all of our clients have their teeth? Do they have all their teeth? Do they only have a few teeth? If you have, say, 1 or 2 molars on the bottom but nothing on the top, you have no ability to grind your food properly. So you need to think about that. Our teeth are very important items in the process of breaking down food and chewing properly. So if your clients do not have a full set of teeth, then they probably are going to have some difficulty chewing up certain foods. The other thing is, if you remember, I talked about how Jill moved the food from side to side in a pattern which is known as rotary chewing. And part of our job when we come in is looking to see if that person is actually got full, typical, well-developed chewing function. And I come in and I often see, and I'll hear staff say, oh yes, that person chews. But in fact, when I look at them, all they're doing is moving their mouth like this, up and down. They really are just moving their tongue around. They're not absolutely chewing their food. And so it may look like they are, but in fact, oftentimes they're not. And that can be a choking hazard. Now I'm going to ask Jill. Jill, when you chewed up, just before you swallowed, was the food very, very smooth when you swallowed it?
No, it wasn't. It was, I could still feel texture, parts of it in it, and it was sticky.
Okay. So with the little particles that you feel, if you had to describe what size the particles were, how would you describe that? What size would you say?
I would say like a crumbled cookie, fine, like ground beef,
Okay.
Small little particles,
Okay.
but not smooth.
Okay, so maybe like some pieces, maybe the sesame seed size or just a little bigger than a sesame seed?
Mm-hmm.
Okay.
Mm-hmm.
The research that has been done, because in fact they do measure food that has been chewed up of most of us, how we would chew up our food. And in fact, the size pieces that we normally chew to is between 2 and 4 millimeters. So 4 millimeters is the space between the tines of a fork. That is 4 millimeters. 2 millimeters would be about half that size, or the size of a sesame seed. So if the person you are supporting cannot chew their food up adequately, then what we need to do is break down and mince up that food to particle size that is between 2 and 4 millimeters. And that is a really important thing, because if they don't chew their food, they are swallowing it in the size that you are giving it to them. So if it's a ½ inch or it's an inch, that's what's going down. That is A, choking hazard, and B, as Jill would say,
Yes.
the stomach.
So the stomach does not have teeth. So this is our own personal blender. The mouth is your own personal blender. If this part isn't working, it goes down into the stomach, not chewed. You have these big lumps, and the acid cannot break down all of those lumps. So then it goes into the intestine, and that's when we run into problems with constipation, because you have undigested food.
Okay, so a very easy method of checking to see if the food is going to be the right size is if you've put it in the blender or pulsed it through and you're checking the particle size, take your fork, place it through and check. If the pieces come up through between the tines of the fork, then you have 4 millimeters. If they're not, if they're too big, you need to mash through until the particle sizes are the appropriate size. So that's a very, very important thing. So get your fork out. It's like a measuring tape. It's a very easy way to double check, and it's quick, and you just mash through your food, and there you go. You should have on your little plate of goodies now a small round Breton cracker, and I'm going to get Jill and yourselves to please do the same thing. Put it in your mouth, count your chews, and just get a feel for how this cracker might be different from the other cracker. Go ahead, Jill. How many chews was that?
11.
11 chews. So quite a lot different from the last cracker. Why would that be? They're both crackers, right?
So this cracker I was able to break with my tongue just by pushing my tongue up, and it broke into several pieces. I could not do that with the stone wheat thin because it was hard and solid. I had to break it with my teeth. So once I started to chew, it broke down very easily. The saliva mixed in easily. I used my tongue to move the cracker into the center and be able to swallow it. So what is the difference between the stoned wheat thin and the Breton cracker? It's a different ingredient. I mentioned that stoned wheat thins are made with water and flour. Bretons are made with water, flour, and fat. So the fat makes it more dissolvable. It makes it softer and much easier to chew.
Okay. So our last cracker, because again, this is all crackers, is a rice cracker. So if the size is too big, you may break it in half if you're finding it a little bit too big to put it in, but break it in half and go ahead and chew that, Jill. Now the thing I'm really noticing is I can sure hear the crunch with this one.
That was 15.
That was 15. Okay. What was different between this cracker and the other ones?
So I couldn't break it with my tongue. I had to put it into my molars and it was very crunchy. But once I'd broken it down, it absorbed the saliva very quickly and was easier to swallow.
Right. Most of the time people find, because it's a very brittle kind of consistency, that they do have to almost pulverize this kind of cracker.
All crackers are not equal, and so when you're shopping out, or if you're making the shopping list for the home, you need to specify the type of cracker. So you would probably not say stone wheat thin, you would lean more towards the Breton type of cracker.
Okay. So now the one everybody's been waiting for are the popcorn twists. And so with this one, I'm going to have Jill just put it on her tongue, and actually I don't want you guys to even chew it. I just want you to press it around with your tongue and see what happens to that popcorn twist.
And it's gone. Just
All
about.
right. So popcorn twists are a category of food that we call transitional foods or meltable foods. And the way that this works is that it's hard when you pick it up. You place it on your tongue. When it comes in contact with moisture and a little bit of pressure, it basically dissolves. And the reason why we like this category of food is that we know how much group homes love to party, and we know how much the clients look forward to it. And it's really not much fun if you're at all these great parties with all this wonderful food and that individual can't have the majority of it. So there are a few types of treat foods. I think Jill would agree they're not whole food groups. Treat
They're the
foods.
fifth food group.
that a lot of the clients can now eat, and I think many of the homes are familiar with them. So popcorn twists are a meltable food. The very soft, big cheese puff style, not cheesies, but cheese puffs, they will also tend to be a more meltable type of food. So those are those little treat foods. Something like popcorn is completely not a good food to offer to people. It may be low-cal, but it's a very high choking hazard, and that's not one of the foods that we want to promote.
So a little word of caution, of course, what makes these treats so good and dissolvable is our friend fat again. So these are used in moderation.
Very moderation. So one of the other things we wanted to talk about is, because we've talked a lot about chewing and what's required for that. So many times, although our folks may not be able to eat a full regular diet, and a regular diet is everything and anything, they may still have the ability to chew some types of foods up. So the foods that are usually recommended are what we call soft and bite size or easy to chew foods. And an example of this is something like a nice piece of ripe banana. But how do you know that it fits that category of soft and bite size? Well, first of all, bite size, as what we recommend, is about 1.5 centimeters. 1.5 centimeters is about the size of an adult thumbnail, and I'll just show you my thumbnail right there. So that makes for a very easy way to do a quick measure when you're cutting up food. And the reason why we want you to cut the food particles to this size is that we know that the size of an adult airway, sort of the average size, is about 1 inch. So 1.5 centimeters is about half of that. And the idea is that if that piece of food happens to go in their airway, they will still be able to get some air past and hopefully be able to cough it out themselves. We don't want them to fully obstruct the airway. So that's why things like hot dogs, whole grapes, and foods like that that are nice shape and size to block an airway are not foods that we like to have people being offered. They are a higher choking risk. So that is about the size particle. If we're recommending it, that's what you'll see written in the mealtime guidelines. The other thing is, how do you know that it's soft enough to easily break down without a lot of chewing? There's a simple test called the spoon or the fork pressure test. And there are resources that we have provided to your home that will actually outline how you do that. And so what you do is you take a fork or a spoon, you place your thumb right in the sort of bowl of either one of those, you press down with just enough pressure that the end of your thumbnail turns white or blanches. What you can see here is that my banana broke down, or smooshed being the technical term for this. It broke apart. It's not springing back up and coming back into this the original shape. So this food is going to be soft enough for somebody to easily break down if they don't have good chewing skills, but they're still able to do a little bit of chewing. And the reason for that amount of pressure, or how we've correlated it, is that amount of pressure is about the same amount of pressure your tongue uses in your mouth when you're actually breaking food down. So that's, again, a very easy little test for you. So once more is place your thumb on there, press down. When the thumbnail blanches and the food breaks apart, that tells you it's soft enough for it to be safe to offer to that person. You all will have some applesauce in front of you, and so I'm just going to get everybody to take a mouthful of that, chew it or do whatever you have to do with it, and swallow it, and then let's talk about how that worked for you and what you needed to do. Go ahead, Jill. Okay, that didn't take you long.
No effort with that. I was able to place it on my tongue, a little bit of saliva came up, and away it went. Very easy. I didn't have to chew or break it down at all.
Is there much food left in your mouth right now?
Very little.
This is a pureed, what we would consider a pureed food, or if it was a liquid, we would call this extremely thick or pudding or spoon thick. A puree would be used when somebody really has no chewing skills and perhaps has a not very safe swallow. We would be moving to a very smooth puree type of food. So certainly we can make it very smooth and break the particles down, but we have to make sure it has enough moisture in it, because if this is sticky, it's going to be very difficult for someone to swallow. So the test that we use to ensure there's enough moisture in puree food and also your minced moist foods is a test called the spoon tilt test. So Jill's going to give an example. You take a scoop, she turns it sideways, and it should plop off the spoon and fall in one piece. If it's running off quickly, it's probably too thin. If, for example, Jill had peanut butter on that spoon and she turned it sideways, it is smooth, but it's not going to fall off the spoon because it's very sticky. Okay, so you can see how it's plopping off, and it may spread slightly on the plate or the in the bowl when you do it, but basically it's got enough moisture in it. So we want, there's sort of, we don't want too much and we don't want too little. We just want it just right. So that's the test that you guys are going to use for managing that.
So then we have something we call mixed textures. This could be something like cereal, dry cereal and milk. It could be something like a chicken noodle soup, or it could be something like this, fruit cocktail. So we have the chunks of food in a very thin liquid. So when you put this into your mouth, you are confronted with two different textures. The liquid, you have the need to swallow, and sometimes that will go back without you even being able to initiate a swallow. It just goes right back. And then you're left with these lumps in the food. Depending what it is, cereal sometimes can be quite soft because the milk has softened it. But when you come to canned fruit, there is a chemical put in that keeps it firm to hold its shape, because nobody wants mushy fruit cocktail. So this actually, when it goes into your mouth, requires a fair amount of chewing. And meanwhile, you have this liquid, which you need to get rid of before you can start chewing. This is quite a complex task. Young children have difficulty with it, and certainly those who are struggling with their swallowing, this becomes quite a hazard.
Mm-hmm. I have trouble with mixed textures sometimes. I have been known to just choke on my cereal. So as Jill says, this is often a food texture that we do not recommend for people. It's better to have things closer together. So for example, if this was maybe a thick sauce and some soft lumps in it, that might work better for somebody. But having it the two extremes is not a recommended texture for them. So if you see mixed texture, now you know what it is.
And this fruit would not be mashable for most parts because it's firm.
Now we're going to talk a little bit about liquids, because certainly everybody needs to drink and we want people to be well hydrated. And I know you guys are great at really tracking and making sure people are getting enough fluids in the day. But sometimes when we give people fluids, we need to think about how well they can manage it. And if you are noticing people coughing and choking when they're drinking their thin water or thin juice or thin milk, there may be a reason behind that. So Jill, why don't you and all of you guys, take a drink of just pour it in your mouth, and I just want you to let it move around your mouth before you swallow it. Okay, and then go ahead and swallow. So where did it go, Jill? What happened when you put it in your mouth?
It pooled underneath my tongue, so it came down underneath my tongue, and then I moved it with my tongue, and it went back, and I initiated a swallow.
Okay, so thin liquids tend to run very quickly. When you have someone who doesn't manage to control the fluids very well in their mouth, it's going to run very quickly backwards, make it in their throat before they're ready, and go into their airway and cause them to cough and choke. So that's one of the most common reasons why we see problems with thin liquids doing that. Now I've made up something that many of you are familiar with, is some thickened liquid. And so I'm going to let Jill take a taste of this. You guys all go ahead. I hope you have your thickened liquid, and yes, I do expect you to have a taste of it as well. So we're going to get you to do the same thing. Just pour a little in your mouth and tell me what the difference is.
So this time it stayed on my tongue. It didn't try to move anywhere. It stayed there, and I was able to control it to swallow.
Okay. So that is basically the rationale behind a thickened fluid. It slows the flow rate down. And that's what's important for someone who's struggling to be able to swallow and get their airway closed. It's not fun to cough and choke through your drink. So our goal is we thicken it as little as we need to get the best effect for someone. So we don't want to put everybody on spoon thick fluids. We want to calculate which is the correct level. And there are different levels. They are known as things like what I would call mildly thick or nectar, which many of you will be familiar with, moderately thick or honey thick, extremely thick, or like a pureed consistency. So you would be often feeding that or managing that with a spoon.
And I have to say that the new thickeners that are now available and that we usually prescribe have no flavor. So it doesn't change the flavor, it doesn't taste starchy. However, it has that texture, so it does have the texture of it like a gel.
Yeah. So one thing I know people ask us a lot, and maybe Jill, you can explain, is that they think people are going to be more thirsty because, well, they're not getting enough fluid to drink if it's thick and it's more like a food.
So the thickener that we're using, in fact, once it hits the mouth, you start the digestive process already, but once it hits the mouth, it starts to warm up. And by the time it has passed through your throat and entered into the esophagus, it is dissolving. By the time it reaches about here, it's actually converted back to thin liquid.
So a half a cup of fluid that you mix is still half a cup of fluid. And the other thing people sometimes ask us is like, ooh, it's some kind of weird chemical. In fact, the thickeners are basically two main products, right?
Yes, so the thickeners that we used to use were a cornstarch based, but the new thickeners are
xanthan gum. We'd like to go through a little bit about mixing because there's some very important things that you need to be following when you're doing mixing fluids when it's been recommended. And when we recommend a specific level, and we want you to be accurate in providing that specific level because it does impact on a person's safety. So it is important that you follow through and do that. So Jill's going to demonstrate right now the correct way to mix up your thickener.
And we cannot stress how important it is to accurately measure. No eyeballing when you're using a thickener. You have to be accurate. So we are going to measure 125 mils. I'm using water, so it might be difficult to see. Look at that.
Well done.
I can guesstimate. So that is 125 mils of water. And what thickness are we making?
Why don't we make level 3 moderately thick or honey?
Moderately thick. So if you're thinking, well, how much do I put in? The can has very specific measurements to achieve this. Now there might be a little variation on what you're thickening, but we're thickening water as is juice, so we will follow this. So right here we have 125 mils and we are going to put in 2 scoops of thickener. So you use the side of the can just to make sure that it's level and you just sprinkle it on the surface. That would be 1. You can mix in the first amount before you add the second scoop. So what's happening, Janice?
Right now it's just starting to thicken, but certainly it's not anywhere close to honey thick. Does it thicken instantly, Jill?
No, it doesn't. It will begin to thicken in water the easiest, but in other things like juice, it will take a little bit longer. And I'm not sure if you're able to see that it's starting to gel up on the sides. So that's why it's important to keep stirring it and then let it sit for a few minutes. It will depend on what you're doing. If you're doing water or juice, 5 minutes you should have the required thickness. If you're mixing something like milk or a shake that has protein in it, it could take up to half an hour until it gets the required thickness. So that's something to really remember when you're doing meal preparation, is to think ahead. Okay, I need to make sure that this milk sits for half an hour before I serve it to my individual.
The water isn't showing very well, but I think you can maybe see that
if I pour it off, you can...
It's falling off and dripping. And actually, one of the tests you can also use to just double check. I mean, we're going to show you a couple of tests to check. One is called the fork drip test. And you can see that it's, as we lift it up, it's dripping through the fork. So this is for level 3, moderately thick or honey consistency that we just put together there. The other way that we have for testing is a new test called the flow test. And for this you require a 10 milliliter syringe. what we do for this is after you've mixed and let it sit, you take 1 syringe, you fill another one, the 10 ml syringe, you're going to fill it up to the 10 ml mark. Sometimes you have to shake it a little bit to get it, depending on the thickness that you're testing. Then what we're going to do is, Jill is going to look at my watch with her glasses, because I can't see.
We need all the props.
She's going to time me for 10 seconds.
Okay, go.
And what's going to happen is you're seeing that the fluid is dripping through my syringe.
And that's it.
Okay. All right. So you'll see that there is still some fluid left in my syringe, and what you do is you look on to see what number it is. So this is just under 8 milliliters left. So this fits the category of mildly thick or nectar consistency. And that was in fact what I mixed this one to be. So it's a nice little double check to make sure you've got the correct consistency. So if you're kind of looking at it and thinking, not so sure about this, that's an easy way to check that. And there's some nice videos and lots of information at a website that again will be written up in some of the resource material that you guys have available. So you will have in front of you 3 pieces of marshmallow. So they're basically it's basically marshmallows that have been cut in half. So you should have 3 pieces there. So Jill is now going to take 1 piece, and you guys are all going to do this as well, but I'm asking you to be careful, don't choke. Place it in between your cheek and your teeth on one side. Okay, now take another piece and place it in the other side. Okay, and the third piece I want you to place underneath your tongue. All right, now you're all probably feeling a little like the Godfather. So the idea behind this is that it gives you a bit of an idea of what it feels like when you don't have good oral motor skills. We take it for granted because we have good oral motor skills. But Jill, are you having a bit of trouble, or are you really having to work at keeping your lips closed right now? Yeah, so it's a lot of effort to keep your lips closed, and that will happen with some of our folks. Now I'm going to ask you, and again, please be careful, don't anybody choke, and you don't have to do this if you're really uncomfortable. But Jill, I'd like you to have a little drink, and then I'd like you to have one of those popcorn twists, if you want to. Okay, that looked a little effortful. Yes. Now, can you have something to eat for me, please? Now, I've given Jill something easy to eat, so she got the popcorn twist. But if you're chewing on a piece of those dry crackers, you're probably finding it very challenging. All right. She's having trouble keeping her lips closed. All right.
I also cannot talk.
She can't talk and tell me things. All right, so you may now either spit out your marshmallows or swallow them, depending on what your preference is. And I'm going to ask Jill if she's got them out of her mouth. She hasn't quite got them out of her mouth yet. What it feels like to not be able to do all of the usual things for eating and drinking. So how did that feel, Jill?
Awful.
Yeah.
So you can't move anything around. You feel out of control. You have to make an effort to keep your mouth closed. You really want your mouth open. And then when you add liquid, you have no control over it. So it's just going to go. And the food, it was dissolvable, but if I'd had to choose something, I would not have been, I would have just been munching. And even that was difficult because of the fullness of my mouth.
Okay. So I think it just gives you a bit of an idea. And if any of you felt a little nervous when I said, oh, I want you to take a drink or to eat, that's pretty understandable. I've had people say, I didn't feel like I'd be safe. So I think this is a bit about walk a mile in their shoes. We're helping these folks, but they don't have the same level of control often with their oral skills. So just be sensitive to that and realize that these things are tricky. So our job here and your job is to try and come up with the best way to help them feel as comfortable and as safe and to enjoy their meals as much as they possibly can. We've talked a lot and we've given you guys some experiential types of things as to what kind of problems exist and to hopefully give you some kind of an understanding of why these things are important and why when we make a recommendation it's made the way it is. So I'd like to talk a bit about the actual strategies and the management that we do, or some of the other strategies that we ask people to do in terms of how to work with the client during meal times. So these will be all outlined in a document known as Mealtime Guidelines, and that's a document that myself or one of my colleagues might produce that go along with recommendations from the dietitian as to how we're going to provide the best experience for this person. So one of the things I look at is environment and the person's level of alertness. You should not be trying to give somebody who is not alert food or liquids or even medication. If they're really out of it and they're not doing anything with moving their mouth, it's very unsafe to feed somebody when they're not alert. It's better to wait a little bit till they're more woken up and then offer that to them. So that's an important thing I want you to keep in mind. Also think about the environment. Think about what environment you like to have your meal in. Do you like a lot of noise and activity and like being in a food fair in the mall on a very, very busy Saturday afternoon? Is that the kind of environment you enjoy having your meal in? Or do you like it calm and quiet and social and being able to hear and talk to each other and that? So oftentimes we recommend a calm sort of environment, and that's important to think about. How much distraction? Turn down that noisy TV. You don't necessarily need it on. Put on some nice music if you want something in the background. The other thing to think about is positioning. And I'm going to just demonstrate something here. So if I'm sitting here and I'm assisting Jill and at the table, so I'm going to come along with some applesauce here and want to feed Jill. So, hi Jill, how are you doing today?
Good.
Now I want you to notice something. What I want you to notice is what Jill's head position looks like. She's having to look up at me. And I would like you to all look up at the ceiling and now swallow. Jill, can you do that for me? Can you swallow up at the ceiling?
It's difficult.
Okay. What did you feel? You mentioned it was difficult.
I had to really gather saliva to be able to swallow, and then I had to effortlessly push it back.
Right. Okay, so there's a reason for that. It puts all the muscles on stretch, and the muscles that lift your larynx, and that is what closes your airway, have to work really hard to be able to close that. So the other thing I want you to think about in relation to this is what position do you put somebody's head when you're having to do CPR with them, when you're opening their airway? That position. So do we want to open people's airway directly to get food down into their airway? No, that's not what we want to do. So we don't generally want people looking up at us or extending their neck when they're eating and drinking and swallowing. What we do want is for you to be down at eye level, looking at them, because that's a lot nicer for them, and offering the food like that. So you can see eyeball, but you can also see that Jill's head's come down, her chin's level with the floor, and she's got a more appropriate place. And if she was feeding herself down here, you might notice that she actually will, we all naturally bring our chins down a little bit. So because you're looking at your food a bit and you often will bring your head down. So that's a typical kind of position. So pay attention to your position and take a look at the client. The other thing that's important is that if I asked you all to sit on the edge of your chair and balance on kind of one side of your buttocks and eat an entire meal like that, you would not be very happy with me, because you'd be focusing so much on how uncomfortable it was and how difficult it was to keep yourself on your chair that you wouldn't have much time to focus on your meal and enjoy it. So make sure people are well supported. They're not leaning forward, they're not leaning back, they're not leaning to the side. If there are positioning issues, talk to the therapist and ask for some help in figuring out what the best position is for them. There will be guidelines that I will specify or that their therapist will specify, and also they can help you with getting the right equipment for that individual. There are also a few types of different utensils and cups that we sometimes use. Often we try and use typical kinds of dishes and so forth for people, but there are some things that make it a little bit easier for some folks. So for example, if Jill was tending to lean her head back and the cup was bumping into her nose all the time, then I would look at something like this style of cup. It's short, it's got a nice wide mouth, and when Jill goes to drink, she can tip the cup up and get the fluid without having to tilt her head way back. The other type of cup is something known as a nose cup, and I think you can see there's a cutout right through here. And so just a word of warning, it goes this side to the mouth, not this side to the mouth, because you will have it all over the front of the person. But the idea is we've cut out space for the nose. So Jill's going to demonstrate again how you would drink from a nosy cup. And you can see she can get it all the way up and it's not bumping into her nose. So that may be something that is also recommended. So one thing about it is that, of course, mealtime or eating is something that's really important to us, and it's something we're able to do right from a very young age. And certainly anybody who has a young 1-year-old or 18-month-old will know that they like to feed themselves. And it's the same thing for our clients. If they're physically capable of doing their own eating and being able to pick up the spoon and feed themselves, then that is something we want to encourage. And certainly as an occupational therapist, I like to encourage independence. The person may be a little on the slow side, and certainly we need to factor in situations where maybe they can do some of their own feeding, but they get very tired and the meal gets too long and you have to provide some support and assistance. But there are some ways of doing that in a way that can be helpful and still let them be as independent as they possibly can. So rather than you taking over and starting to feed someone, is talk to your occupational therapist and ask if there's some tips or ideas about what the best way is. Look on the mealtime guidelines. Oftentimes we will write things like, let the person feed themselves if it's 20 minutes or half an hour and they're struggling, and that you may need to take over and maybe give them some help with that. But it is important. We do want people to feed themselves. It's a very normal, basic human function, and we want to still promote that.
So let's talk about medications. We briefly mentioned it at the beginning. And most of our folks, unfortunately, have to take quite a few medications. So with these medications, it can affect their swallowing. It can reduce the amount of saliva they have. It can slow down the muscle tone. And because if it's affecting the central nervous system, the swallow is going to be affected. It also can affect their level of alertness. And it can also change the function of their mouth. As I mentioned, dry mouth, and of course, my very favorite, constipation. So medications can impact. And when you have a nutritional assessment done, we will often list there as a concern medications that will impact their nutritional intake. So you will often see that on the dietitian's assessment. So we have to compensate for that. So that's why we look at the drugs, we see what their interactions are, and we're able to maybe modify, make the food moister or a different consistency if there are issues in the swallowing. Now, the other thing that impacts many of our clients, because often their central nervous system is affected, is actually lower down the chain. So we've talked about the mouth being our blender. We then have our esophagus. Our esophagus gently squeezes If you remember your grade 8, it's called peristalsis. So it squeezes food down. And then when it comes down, it hits a sphincter, or something that looks very much like our hand, and it should be closed. However, when you have difficulties with your central nervous system, your muscles may be relaxed. As we get, when children are young, as babies, this muscle is not as well formed. And then as we get older, we have this slackening, and this sphincter will remain open a lot of the time. It won't completely close. So, over to our trusty little diagram of our stomach here. So we swallow, the food goes down, we hit the sphincter level here, the food passes into the stomach. That's great, especially if we're standing upright. But just stop and think what happens if we lie down, or often after a meal people want to relax. Once you lie down, this little sphincter is not closed, it's open, and food will come back, and that is what we call reflux. So, what happens in the stomach? Acid is added to the food. When acid's added to the food and it refluxes back up, bingo, we have heartburn, because the food will come back up and you'll have that uncomfortable burning feeling right about here. So this is an issue for us. The sphincter is also affected by different types of food. So all food has different properties. Spicy, acidic, high-fat foods will make this muscle relax more and not close well. So when you have a dietitian that tells you this person needs to follow heartburn guidelines, that will be the key to avoid spicy, acidic, high-fat foods that make the sphincter open up even more.
We also wanted to just emphasize, we've talked about the importance of teeth, and we also wanted to emphasize about oral care and why it's so important to have good oral care. Obviously, the more teeth you have, and if you have your full set of your own teeth as opposed to dentures, you're going to be able to manage your food a lot better. And so we want people to make sure they do oral care. Check the mouth. People sometimes pocket food. You don't want to be lying somebody down for their afternoon rest and there be big chunks of food left in their cheeks, because that can fall back in their throat, they can choke, or they can aspirate on that. So make sure you're doing that, and then also doing the mouth care properly. There are dental hygienists who will give some guidelines about how to help manage that. We realize it's not always the easiest thing to do for some folks. And even people without teeth should have their mouth cleaned. There is quite a bit of research that's been done where people who have swallowing difficulties and are at risk of aspiration, they can aspirate on their saliva, and if that saliva is dirty and filled with lots of bacteria, they can actually get a pneumonia just from aspirating on their saliva. So you should always do mouth care, even if the person's tube fed, even if they don't have teeth, and even if it's a struggle. Talk to the dental hygienist and get some advice on what the best way is to manage that person's dental health.
We look today at the mashed or meltable foods, and we looked at applesauce, which is a form of puree. There are many different foods that will have different properties that will affect how they are pureed. One example would be pasta. So I know a pasta is a staple of many group homes, and if you put cooked pasta and water into a blender, you have the best wallpaper glue that anybody could provide you with. That's going to be a problem. So if we are pureeing pasta, we're going to cook the pasta, we're then going to add boiling water and skim milk powder. And this helps homogenize the pasta, and you have a very smooth, glossy type of product that is much easier and not as sticky. Once it gets cold or colder sitting on the plate, you'll notice it'll start to gelatinize and become solid and sticky. So it needs reheating. If somebody's taking a long time to eat, you may need to reheat it. The same method can be used with rice. Rice is probably one of our most horrific foods for us. When you put rice in your mouth, it scatters. If you don't have good collection abilities, then you have little particles there. And if you happen to be laughing and talking and take a breath in, guess where that rice grain is going to go? And then you have the big coughing and choking. So rice, very rarely do we have it on a menu where it would be just plain boiled rice. We'll have a risotto, a pilaf, something where the rice is held together with another medium such as a gravy or a sauce. So another idea for rice, because it is quite difficult to get a very smooth consistency when we puree it, we'll often recommend that you use rice noodles. These, when they are pureed in the manner that I talked about, adding boiled water and skim milk powder, you'll end up with a very smooth rice dish. It will be like pasta, it will be very, very smooth. However good your blender is, to be able to puree rice is very difficult. So we recommend you use rice noodles. And they taste the same.
Okay. One last thing point I wanted to make too is, we talked about the importance for our clients and setting things up and how to help keep them safe. But one other thing that's really important is that, any of us can choke, any of us can have a problem during a meal. And so you being there visually, watching your clients eat, even if they can feed themselves, you should be there, you should be keeping an eye, you should be socializing. Meal times are social kind of things, is be at the table with them and keep an eye on how things are happening, because you really are the first line of defense if something goes wrong and you need to help them. If they're choking on a piece of food, you need to be there for assisting them. So I can't emphasize the importance of supervision for your clients, no matter how kind of physically independent they are for eating and drinking. That's, I think, a really key part of this.
Very key. And we'd like to end up with something for you to think about. What is the one thing that you have heard today that might help you change your practice? How you would find the most important thing. So maybe now your supervisor can guide a discussion about the things that you found fascinating and that you will be able to use.
Okay. Thanks very much.
Thank you.